Next, it is my pleasure to begin our session this morning, session 9, the statewide needs assessment by Community Action Partnership. I'd like to introduce our speakers. We have Andrea Olson. She's the Executive Director for the State Association Community Action Partnership. And Andrea works on a number of initiatives and programs, including training and technical assistance for North Dakota's community action agencies. She's worked in the nonprofit sector for 16 years and has been with CAP ND since 2008. With her are researchers Jilly Gao, an associate professor in the Department of Construction Management and Engineering at North Dakota State University. He obtained his Ph.D. in civil engineering at Iowa State. He's a licensed professional engineer in the state of Minnesota and national certified professional constructor. His current research interest includes lean and green construction, advanced concrete material and construction, and design and construction visualization. He's a member for several transportation research board committees, and as an instructor teaches courses of construction, scheduling and project control, and more. Andrea and Dr. Gao have both indicated that this presentation will not include discussion of any commercial products or services and will not include discussion of off-label or investigational uses of any product or services and will not include trade names. And Dr. Yao Yu is an assistant professor in the Department of Construction Management and Engineering at NDSU and is one of the investigators of the needs assessment study of low-income North Dakota individuals and families. This presenter has indicated that the presentation will include the trade name of the surveying software SurveyMonkey. I've posted the link to the pre-test in the chat, so please complete that. And when we get toward the end of our session, I'll post the link to the post-test. So we'll turn it over to Andrea. Take it away, Andrea.
Thank you so much, Karen. It's really good to see you. Can you hear me okay?
Yes, we can hear you well.
Okay, perfect. And I'm just going to quickly test the advancement of the slides because I know that I think you have to activate that is what Kylie told me on your end. The moderator will activate the presentation session. Is that what's happening?
Yep, yeah, that's going on right now.
Oh, okay, perfect. I'll just give it a second here. Well, thank you very much, everybody, for being here. Thank you so much for the invitation to be a part of this amazing conference. I love coming to these sessions. We have so much talent and expertise in North Dakota, so it's so great to be amongst all of you. Again, my name is Andrea. I'm the Executive Director of the Community Action Partnership of North Dakota, and we're going to be reviewing with you today our recent statewide needs assessment that we conducted. Well, let's dive in here. We're going to go to the next slide, just kind of discussing the objectives of what we are wanting to accomplish with everyone today. We are going to do a review of our needs assessment process, and we're also going to be talking about poverty that exists in North Dakota, and we'll touch on community action at both the state and the national levels. I do want to take a moment. Jerry, is it letting you advance at all to like that third slide? Well, I do want to, on the third slide, when we eventually get there, I do want to acknowledge all of our needs assessment partners and collaborators, because this was a massive undertaking that we did. So you can see all of the different agencies that were involved. North Dakota State University, Dr. Gao and Dr. Yu were instrumental with us being able to do this. We worked in close conjunction with the North Dakota Department of Commerce, also with the Consensus Council, and then of course all the community action agencies across the state of North Dakota. So who is community action? On our next slide here, community action agencies were established in 1964 under President Johnson's administration to fight the war on poverty. So when President Johnson launched the Economic Opportunity Act in 1964, he provided funding for community action agencies, funding for Head Start, Job Corps, VISTA programs, just a plethora of programming under that Economic Opportunity Act, all with the intention of helping people move out of poverty. We do have on the next slide over 1,000 community action agencies across the nation, and we're in 99% of all of America's counties. I'm not going to go over this slide in detail with all of you, but I just want to point out that this slide here indicates a lot of the very unique structures that we have within community action agency. Everything we do is about meeting the local needs and having local control to meet those needs. I want to lift that part of this slide up to all of you because we're going to be talking more about that as the needs assessment conversation continues. The other thing that I would point out on this slide is that community action agencies, we're federally mandated to be operated by a tripartite board of directors, meaning that 1/3 of all of our board of directors have public representation, elected official representation. 1/3 of our representation is from people who are experiencing low income, and the other 1/3 of our board structure comes from at-large membership. Our mission at Community Action is all focused on helping people and changing lives. We're a poverty fighting network that is here to address the reduction of poverty, the revitalization of low-income communities, and helping families who are experiencing low income develop a sense of empowerment and encouraging those folks to become active in their communities and then essentially becoming fully self-sufficient. The promise of community action, Jerry, if you want to go ahead and advance the slides, one more. The promise of community action is that we're here to change people's lives. We embody the spirit of hope, and we're here to improve communities and make America a better place to live. On the next slide, we've showcased for you some of the national work that has happened. And I know it's we had to stretch it out, so it might be a little blurry, but we wanted to be able to showcase to you that our network nationally, we serve over 40 million Americans every year that are experiencing poverty. We have quite a reach in the work that we do. We're working, with seniors, with people who have disabilities, with children, families. And then the next slide there is just more additional information about our impact at the national level. But we'll go to the next slide, which showcases the community action agencies in North Dakota. And I really like this map because I think it's such a great visual representation. So all of our community action agencies in North Dakota serve a designated territory. We use the 8 designated regions in North Dakota, and you can see that there in front of you. And we do collectively serve all 53 counties. Our main offices are housed in major cities across North Dakota, and those are listed on the slide as well. But collectively, we do provide service statewide. We're in all 53 counties. So now on the next slide, who is CAP&D? Who is Andrea? Why is she even here? What purpose do they serve? So CAP&D is, as Karen mentioned, the state association for all of the community action agencies. So those 8 community action agencies that exist across North Dakota, they belong to a membership organization, to a statewide association, and that's my organization, that's CAP&D. So we do a lot of training and technical assistance.
And we also do program administration.
Our involvement in the needs assessment was quite vast. We led this initiative on behalf of all of the community action agencies.
we administer, and I'm just going to touch on these.
Very quickly, just to help you understand again, like who I am, who CAP&D is, and what we do. So on our next slide, you can see we administer the Sportsmen Against Hunger program. And this is a program that was actually born out of the results of these needs assessments that we conduct. Historically, lack of access to food is always one of the top 3 needs that our needs assessments continually demonstrate year after year after year. So we started the Sportsmen Against Hunger program, and Sportsmen Against Hunger is not unique to North Dakota. It does exist in other states, but what's so cool about it is that it's an opportunity for sportsmen to donate their game that they've hunted. They can donate this to our program. CAP&D covers the processing costs, and then in turn, we put the meat in the hands of clients via our food pantries and other food pantries that exist across North Dakota. On our next slide, again, just touching on these very quickly, this is our supportive service for veteran families, SSVF. This is a program that this is all about veterans who are either currently experiencing homelessness or are on the brink of homelessness. So we have a very intense SSVF program that helps veterans out. We also have a statewide weatherization program, and this program is designated to increasing energy efficiency in homes that are low income. So we do a lot of energy assessments. We use a lot of advanced diagnostic equipment to go out and weatherize homes for folks. And Jerry, if you want to go up 2 slides, additional community action programs. One more slide, Jerry. And this is where I want to touch on that whole, oh, if you can just go back one, Jerry. This is where I want to touch on can you please go back just 1 slide? Yep, there we go. Thank you to this additional community action programs. So what I want to point out here is that not every community action agency is the same, and that's because the needs in every community aren't the same. So one example would be a family planning program. Our Fargo Community Action Agency that serves all of southeastern North Dakota, they don't offer a family planning program because there's other entities within Region 5 that provide that service. But on the western part of the state, our Dickinson Community Action Agency, up until very, very recently, has offered a family planning program. And they've done that because nobody else in their community can do that. So that's really one of the kind of unique flexibilities that community action agencies can offer. We are designed to meet the local needs of communities. And that's why we continue to do needs assessments, because we want to continue that, we want to ensure that we are continuing to meet the needs in the local communities. So Jerry, we'll go ahead and go to that next slide that says, what does self-sufficiency mean to you? There we go. So you can see that this is, what this is here is this is an outline of what we're trying to do at community action agencies. So when people present at community action agencies, we often find that folks are in crisis or they're feeling very vulnerable. And our goal at community action is to help people cross that yellow line that you see there on the middle of your screen, that prevention line. We really want to push people into the realm of stability and safety and to be thriving and to be self-sufficient. But what is really important for all of us as providers, whether it's in healthcare or social service agencies or whatever the case may be, is that self-sufficiency means different things to different people. Thriving for some families, I just talked to a client a couple days ago. She said, you know what? I'm living with my sister and we are happy and I'm thriving. And she's like, but I know that this wouldn't be what other people consider thriving, but that's thriving for her. Maybe thriving for you or somebody else is, owning a home with a white picket fence. Maybe that's your definition of thriving, and that's totally fine. But living with your sister and doing well and making all of your ends meet can also be thriving. So that is an inherent and a critical part of the work that we do at Community Action. So wanted to lift that up for all of you today. And we're going to go to the next slide here. And this is what we just called the North Dakota Community Action fact sheet. And I think it's really important for all of you as healthcare providers to know that, and I know you know this, but I think it's really important to reiterate that poverty exists in North Dakota, and it's very real. Every year in our community action agencies, we're serving over 12,000 people in the state of North Dakota. And if we can go to the next slide, you can see that we have outcomes in all these different categories: employment, housing, health, civic engagement, so on and so forth. So again, just reiterating that poverty does exist in North Dakota, and just us at Community Action, we're serving over, like I said, 20,000 people, and we're going to talk a little bit about poverty guidelines and who qualifies for programs, but I want to touch a little bit on poverty in North Dakota. So we're going to advance to the next slide. And we're going to jump into the federal poverty guidelines. So I know that some folks are not completely versed in federal poverty guidelines, and that's okay. Just very quickly, I will say that the federal poverty guidelines are published by the U.S. Department of Health and Human Services on an annual basis. And because we use federal funding, we are required to follow federal poverty guidelines. So let's look at this chart here, and you see 125% and 200%. 125% of the federal poverty guidelines, let's take that family of four, for example. Family of four, in order to qualify for programs at community action agencies, you cannot be over 125% of poverty. So for a family of four, that's $33,125. For a family of five, it's $38,800, so on and so forth. The reason I want to point this out is I really want you to understand who is qualifying for services at Community Action and other transfer benefit programs, and just how incredibly low these incomes really are. Now, Dr. Gao and I also added 200% to this chart because under COVID guidelines and CARES funding that's come out, we have been able temporarily to raise our income guidelines to 200%. But when we're talking about TANF, SNAP, which used to be called the food stamp program, when we're talking about any of those programs, people have to meet these federal poverty guidelines. And then we'll go to the next slide, Dr. Gao, and these are the types of income verification that we look at. We have to look at all of the pay stubs, all the tax forms, bank statements, you name it, we've got to look at it. And there's an abundance of research out there that proves that welfare fraud is actually less than 3%. We'll go to the next slide, please. Talking about benefits for families in North Dakota. These are some of the programs that I just mentioned, like TANF, SNAP, LIHEAP, Medicaid. I want you to be aware that these programs exist, but I also want you to visualize that 125% to 200% federal poverty guidelines, because those are the folks that are qualifying for these programs. Okay, so you have to be very low income to qualify. You have to prove that you are in fact very low income. And I assure you, we look at everything because we're mandated to, and we do our due diligence. So let's go to the next slide, and we can see just how many people are actually qualifying for these programs in North Dakota. So what we tried to do here was take a snapshot of like the western part of the state, the central part of the state, and the eastern part of the state. So we looked at Ward County, Burleigh County, and Cass County, and then their surrounding regions. And I'm not going to go over this in great detail, but I want to draw your attention to that last column there, the SNAP column. That's Supplemental Nutrition Assistance Program. You can see in Ward County, over 6,000 individuals qualified for that program, and over 2,600 of those applicants were children under the age of 18. You can see in Burleigh County, almost 7,000 people, 2,900 were children under the age of 18, and you can see in Cass County, over 16,000 people and over 7,400 children. So again, it just the message is reiterating that poverty does exist in North Dakota. In order to qualify for programs, you have to be extremely low income, yet people are still qualifying. And that's what we're trying to showcase here, is that people are in need, people qualify, and people are receiving some benefits. So we'll go to the next slide, and this comes from the Economic Policy Institute, and they have a plethora of amazing research that exists at the Economic Policy Institute. They've drilled down in every county in the United States, and they have come up with, like this chart that's here in front of you, they've come up with, what do you need to make as a family of 4 to just meet basic requirements? Meet your basic living expenses, your housing, your food, your childcare, so on and so forth. And this slide here shows you what their research demonstrates for Burleigh County, for Cass County there in the middle, and Ward County over there on the right-hand side. So like Burleigh County, the Economic Policy Institute research indicates that your average family of 4 needs to have an income of $92,210 in order to be able to afford housing, food, childcare, healthcare, so on and so forth. And I would draw your attention here to childcare, because this is something that we have increasingly becoming aware of across North Dakota, is not only the availability of childcare, but just how expensive childcare really is. And I know I'm not alone in the story that I'm going to share. I'm a family of 4. My husband and I have 2 small children. And when our girls were still in daycare, we were literally paying more just in daycare costs than we were for our mortgage. Childcare is very, very, very expensive, and we've seen that become a larger and larger issue and having adverse consequences for people who are experiencing poverty. We'll go to the next slide, and again, just touching on some poverty that exists in North Dakota. In 2013, NDSU and UND released a study saying that wages for graduates haven't kept up with inflation, that on average, students were borrowing about $7,800 a year, which is a 125% increase over the past decade. During that same time, we've also seen federal student loan rates double. We're going to go to the next slide, and this data comes from North Dakota Kids Count, and I would draw your attention to the list at the top in the health and wellness categories. How many children have been without health insurance? How many are enrolled in Medicaid or CHIP? I won't go over those numbers in detail. I just want to draw your attention to that. But this is North Dakota data coming from North Dakota Kids Count. And we'll go to the next slide. In 2019, CFED, the Corporation for Enterprise Development, they reported that the average credit card debt in North Dakota is over $5,800. that over 38% of consumers in North Dakota have subprime credit scores, meaning that your credit score is below 700. I'm not going to go over this in great detail, but I do want to lift up the fourth bullet point there, that 40% of North Dakota households could not subsist at the poverty level for 3 months. So meaning folks that had some type of adverse event in their life right now, 40% of North Dakota households could not suffer an event and be able to sustain at the poverty levels for the next 3 months. So it's something we really need to keep in mind. We'll move to the next slide, and this showcases that over 57% of households in North Dakota have an income of less than $75,000 a year. And then one last statistic that we will bring to your attention is on the next slide, and that shows that 46% of Americans cannot cover a $400 emergency. This was a study that was conducted by the Federal Reserve. And when they were doing their research, they learned that people will instead put that $400 emergency on their credit card so they can pay it off over time. Maybe they're borrowing the money, or maybe they just simply can't cover it at all. The Federal Reserve also reported that 81% of people making more than $100,000 a year reported that they would be able to cover that $400 bill, but the remaining folks, those folks earning less than $40,000 a year, said that there would be no way they could cover that $400 emergency. So let's move in now a little bit more into the needs assessment process. We're going to talk about why we even do the needs assessment. And I touched on this a little bit throughout the presentation, but needed to do so. So there is that. But we also want to ensure that the programming that we're offering is meeting the needs of the local community. We use our needs assessments to develop our action plans, and our action plans are targeting what I talked about earlier, how our goal is to help people achieve economic security. We want the communities where people are living to be thriving and healthy communities. And we want people who are experiencing poverty to be engaged in their communities. So there's a lot of substantive reasoning why we do the needs assessment. We'll go to that next slide. I touched on this already, that it's a requirement for us. One of the our list of requirements that we have to follow are called organizational performance standards. And those are mandated for us at the federal level. And it says in there in many different ways that we need to do the needs assessment. We need to engage people who are experiencing poverty, and we want to hear from them. The other thing that we've been talking a lot about is on the next slide, and this is social determinants of health. And I really wanted to make sure that we touched on this during today's presentation because so many of you are in the healthcare field. But what our network has come to understand and to accept is these social determinants of health. We understand that a relationship between health and economic status exists. They don't live in silos apart from one another. One impacts the other. So somebody experiencing poor health, that can result in poverty, and vice versa. Poverty can be the result of poor health. So we have all of this in mind when we moved into what we'll talk about on the next slide, is our needs assessment process and the research design. So this is where Dr. Gao and Dr. Yu and their incredible knowledge and expertise comes into play. And Dr. Gao put together this very cool roadmap for all of us to follow. So we, roughly about 2 years ago, we're getting ready to establish our partnership with NDSU, and we had a lot of, planning meetings and committee involvement and that sort of thing. And then as time went on, we were really able to dive into the research design phase. And this was what was so cool about having NDSU involved, is that this is their wheelhouse. They, Dr. Gao and Dr. Yu are researchers, and they were able to help community action with this process. So we developed surveys for collecting quantitative data, and then we also collected qualitative data via focus groups. We had paper copies of surveys, we had online surveys that we distributed all across the state throughout our 7 community action agencies and all of our partner agencies. Simultaneously, while we were doing that, we were also having small group discussions across the state, some small focus groups. And then, of course, COVID happened, and that our first few weeks of data collection was just amazing. The amount of data that was coming in was incredible. They were higher numbers than we had ever seen before. And then unfortunately with the pandemic, we did have, it was a wrench in the plans, of course. We had to really pivot what we were doing at Community Action to really focus on emergency services. And that greatly impacted our ability to collect the data. And not only were we having to pivot and focus so much on emergency services, our partner agencies were having to do the exact same thing. So we really just did the best that we could based on those circumstances. We ended up with a total of 3,458 surveys that were collected. Over 1,000 of those were completed by community action clients or other people who are experiencing poverty or are considered to be low income. We had over 2,000 people who are not considered to be low income fill out the poverty. And then our catch-all group of other, we had almost 300 other. So we continued to collect the data. NDSU really crunch the numbers, so to speak. I know that that's not the right statistical analysis term, but this is where really their expertise became such an incredible advantage for us. The needs assessment categories were related to employment, income and asset building, education, housing, health and social behavior, civic engagement, and other supports. And as you can see on this slide that Dr. Gao is sharing, for the quantitative results, at the top of the screen, if you just read kind of left to right, it says 2006 needs assessment. So historically, our needs assessments have said we need, people need help with food, people need help with utilities and with dental care. But in 2020, we were able to take people's responses. If people were experiencing poverty, those responses are listed in blue. And people who are experiencing poverty all across the state told us rental assistance is our #1 need, followed by dental insurance and affordable dental care. And then third was food. If you look in the middle, in the yellow, the 2020 needs assessment needs for non-low income. So these are people who are not actively in poverty right now. These are the needs that they identified: mental health service, health insurance and affordable health care, and budget and credit and debit counseling. And then the kind of catch-all, where the number one need identified was dental insurance, health insurance, mental health service. And we definitely feel that there are themes that exist between those three categories of people who responded. And then you can see on the lower left-hand quadrant, it has employment, income and asset building, so on and so forth. It has those 9 categories of our needs assessment. And the blue are the responses from people who are low income, and the orange are responses from people who are non-low income. And again, just that reiteration that affordable housing, rental assistance at the very top of the need for people who are experiencing poverty. And then on the lower right-hand quadrant, you can see those categories again and those different percentages across the board. And then our next slide is a really nice visual representation that breaks it down even further. So instead of just having that statewide lens, this is a regional lens. So you can see regionally what people who are currently experiencing poverty identified as the biggest need for them. And in every region except region 8, housing was the number one need that was identified. And I should also mention that these slides have been made available, so you guys will have copies of this, and all the sources are cited in there for you as well. Let's talk about the qualitative data for just a minute. So these are, qualitative data, meaning verbal, right? Like and written answers. These aren't tied to numbers. These are people's statements that they were able to make. And you can see on the left-hand side there that the frequently mentioned causes of poverty just across the board that we kept finding again and again in these qualitative results were bad record or a bad background, because that'll affect everything. That'll affect your ability to access services. That'll affect your ability to get into stable housing. Major ramifications exist for people with bad backgrounds and bad records. Family instability was also identified, disability, mental illness, severe anxiety and depression. We talked a little bit about childcare earlier in this session, but childcare issues for working parents was another theme that presented itself in our assessment. Fewer or no skills for jobs, meaning that they just can't find better jobs with better pay and benefits. And of course, COVID made the list, which made sense because we didn't start the assessment during the pandemic. The pandemic happened during our assessment. Lack of affordable transportation, lack of education, generational poverty, and lack of employment opportunities. So some really substantive answers from people that we were really trying to obtain that information from. We wanted people who are experiencing poverty to complete this survey and visit with us in the focus groups and help us understand what the needs were. Lastly, we'll talk about needs assessment results dissemination. So we, well, I personally have just been glowing from the needs assessment. The partnership with NDSU really helped catapult our needs assessment process into the next level of where we needed to be. So we are very proud of this assessment. And we were very excited to share it statewide. We continue to share it. So we've done a lot of just vast electronic distribution, emailing it out, our electronic newsletters, those types of things. We did a lot of media interviews, press releases. With the start of the legislative session at the beginning of the biennium, we gave a copy of the needs assessment to every legislator in all 53 counties. Everybody got a copy of it. We've presented this data to the congressional delegation. We also have it on our website, so if anybody is interested, www.capnd.org. It exists, all of the information is on there. And then what we're really trying to focus on now is getting the information into the hands of the people that so graciously completed this survey for us. We want them to understand that that we really value their input. So we're working on that right now. And then moving into the future, we of course hope to continue our work with NDSU. We're going to continue to use needs assessments to structure our programming. We want to get to a point where we have those 9 categories and that we can compare the data over the long term and identify different trends. We want to get to the point where we can crosswalk the data with other needs assessments. And oh, I see that Shannon put that in that's one of your questions, Shannon. Are there opportunities for this data to help inform the community health needs assessments that hospitals conduct? 1,000,000%. Like, please call me, email me. Let's make this happen. Karen has been awesome too. Well, Karen is just awesome, of course, but Karen's been particularly awesome with the needs assessment, and she was really encouraging us to make that happen. And honestly, I think a lot of that would have happened already, but I hate to keep talking about COVID, but just everything, was completely derailed and turned upside down, but that's really where we would like to go. So yeah, that's all of the data and information that we wanted to share today. Dr. Gao, thank you for sharing the slides, and thank you everybody for your patience with our technology issues. But Karen, would love to turn it back to you, and we're happy to answer any questions.
Thank you so much, Andrea. Dr. Gao. Oh, your video is working, Dr. Gao. We can see you now.
Don't know why. Looks like NDSU dropped the firewall.
Wave to everyone so everyone can see you. I think Shannon asked a good question, which Andrea already answered. And I see Brad Gibbons from the Center for Rural Health. He wants to let people know that they are conducting about 85 to 90% of the community health needs assessments. And I hope that you heard like me and you see a theme here in our presentations during this conference so far of themes that are coming out from the Department of Health, Health Equity presentation, Social Determinants of Health from Dr. Kathy Anderson, supporting the whole child, mental health needs, how that's rising to the top of people, all families, no matter their income level. Really, I know Andrea is so receptive and eager to answer your questions. And you can find her or shout out your email address if people would like to get in contact with you.
It's Andrea at capnd.org, and I just put that in the chat window too. But and Shannon and Brad and anybody that wants to collaborate. I don't want to volunteer you, Dr. Gao, but I think I just might have a little bit. And I'll say, Dr. Gao and Dr. Yu, they are so invested. And I do want to share a story that Dr. Gao shared with me when he and I first started this project together. These researchers, Dr. Gao and Dr. Yu, have an incredibly vested interest in poverty for the sole purpose of making the world a better place. And Dr. Gao has spent a ton of time on public transit in Fargo and really wanted to get to know people. And Dr. Gao shared with me some of the stories of the people that he encountered, including somebody who shared that when the bills come every month, it's just so stressful and overwhelming that they throw them up in the air, and whichever one they catch, that's going to be their focus. But I think that's a testament to you, Dr. Gao, and to Dr. Yu for your compassion for others and for helping us lift this data and giving a voice to people who often don't have a voice. So I just want to thank you for that.
Thank you for your comment.
Yes,
So
thank you so much.
I personally enjoy doing this a lot. Not too many people understand why I'm so happy doing this, because I saw the top ranking food from 2006 move down to 3. That means that we filled most of people. So, Andrea and the other organization, you guys did a good job on that. Thank you.
Yes, thank you so much
Absolutely.
for the Community Action Partnership of North Dakota for your presentation today.